and all the gas stations were closed. We're like in the middle of nowhere. We see a police officer. We ask him if there's anywhere to get gas. He takes us to the police station, fills our tank up, and says, "See you guys later. Keep it slow till you're outside the city limits."
Oh, did he really? How
Yeah,
nice.
that's how people are in Iowa.
Gosh, that's nice.
We're on.
Ready to go.
Okay. All right. Welcome to the health and wellness class. Tonight we are going to be focusing on auto injuries. A little bit about myself. I'm a graduate from the Palmer College of Chiropractic in Davenport, Iowa. In 1995, I became a chiropractic neurologist. And then in 1996, I founded Hartley Chiropractic in St. Augustine, Florida. In 2011, I became a fellow of the Palmer College of Chiropractic Academy. And then in 2015, I became clear certified in scoliosis. In 2016, I became a clear intensive care scoliosis doctor, and that allowed me to see patients that came from other states and countries to work on more advanced scolioses. And then in 2017, I became a Scoli brace provider, and we're going to talk about Scoli brace in a little bit, but it's an advanced way of bracing the spine for correcting misalignments. All right, what do you think the USA is ranked today in overall health?
Probably about fifth.
We'd like to think so. 37.
Oh, wow.
That might be some of the reasons.
Mm-hmm.
Would you agree we should be a lot higher than that?
Not if we're going to stick to what's on the
But
screen.
we'd like to be number one, right? We want to be the healthiest country in the world. What do you think we're ranked in for mortality?
No idea.
51st.
Oh, gosh, really?
Or 52nd rather. And people have trouble with that one because we have such advanced medical systems. But birth is already something that's perfect. And sometimes when you improve on something that's already perfect, you actually make it less perfect. Yeah. And there's third world countries that have a better infant survivability rate than our country. Over 1 million mothers, daughters, fathers, and sons will die from heart disease and cancer this year. Would you agree we need to make some major changes in the way we approach our health?
Oh, absolutely.
So there's 5 attitudes that prevent us from being healthy. It's out of my control. It's normal to get sick. Disease makes us sick. Only see the doctor when you're sick. It's expensive to be healthy. Those are the 5 attitudes that prevent us from being healthy. The first attitude is health is out of my control. You can't blame everything on your parents. Less than 1% of all health problems are related to genetics. Health is simply the result of healthy habits. The things you do every day determine how your health is. Are drugs the answer to humanity to these problems? Well, the United States consumes more drugs than any country in the world, yet we're ranked 37. Mm-hmm. So if drugs were the answer, we would be ranked number 1. All drugs cause side effects. So you take a drug for one condition, and then it will cause another condition. Prevention versus crisis. If you buy a new car, drive it as hard as you can, never change the oil, never do any maintenance, eventually that car is going to blow up. If it blows up outside a new car dealership, then you can just step out of your blown up car and get into a brand new one, right? But you can't do that with your body. You got to take care of yourself. So you got to practice prevention. What are symptoms? Symptoms are merely the result of the body being out of balance and alerting you to a problem within. Symptoms serve as a warning that something needs to be explored and changed in one's life. Illness is a message. Dennis Jaffe, PhD. So if the fire alarm goes off, you're not going to cut the wire to the fire alarm. You're going to find out what the problem is, right? So many procedures that are done are not finding out the cause. You're just taking medication. Like we just had a patient in today, and she was talking about these neuromas that were in her foot, and they were going to do a surgery to take the neuromas out, which would hopefully get to the cause of the pain, but they gave her a pain cream to put on instead, which would never get the neuroma out, which is like a cyst on the nerve, which is
Gosh.
what was causing your pain.
Oh, wow.
Second attitude is it's normal to get sick. Is it the seed or the soil that keeps you healthy? Well, first of all, is it normal to get sick?
Well, to a certain extent, yeah. Because you have to build up your immunity.
It's normal to get symptoms,
Um,
but what's your definition of sick? So if you got a fever, would you
sick.
consider that sick or healthy?
Sick.
Okay. So if you ate a bad oyster and you started throwing up, is that good or bad?
It would be bad because maybe bacteria infection.
It would be good because you're getting it out.
Oh, I see what
right?
you're saying. You're ejecting it. Yes.
So your body is healthy.
Yes.
You're having a negative symptom,
Right.
but a positive response.
Gotcha.
So let's say you have an infection and your body develops a fever.
Right.
Is that good or bad?
Be good.
Good,
Because
because your body's responding
to it.
the way it should, right?
Yeah.
So with health, is it the seed or the soil? The seed is like your genetic potential. And there's plenty of people, excuse me, there's plenty of people that have a great genetic potential, but never amount to anything. The soil is like the environment. There's also people that don't have a huge genetic potential, but then become great people because of their environment. So persistence wins over talent.
Right. Gotcha.
Disease attitude. So we've eliminated most of the excuses for not being healthy, right?
Right.
It's we're saying it's genetics is a very small percentage of it, right? Third attitude is disease makes us sick. Well, Hippocrates talked about health as ease, right?
Oh, right.
And then with the hyphen, disease means you're moving away from health.
Health into this. Yeah.
And then disease, where they can see it under the microscope and you have a full-blown health problem, is disease without the hyphen, right? So disease or disease is lack of harmony inside the body. We're out of balance. We spend billions of dollars a year studying disease and virtually nothing on health. So if we focus on disease, what are we going to get?
Sick.
And if we focus on health,
healthy.
Yeah, so Mother Teresa was asked to speak at an anti-war rally and she declined and everybody got upset. I can't believe she wouldn't speak there. And then in her response, she said, I'd be happy to speak at a pro-peace rally, because she wanted to focus on the solution, not the problem.
Right, gotcha.
How life begins. 2 weeks after fertilization, the primitive streak is created. This will become the central nervous system, the master system, controlling every other cell, tissue, and organ in the body. Hold on, we are going to relate this to auto accidents, and you'll understand that in a second. So you have the spinal cord, and everything grows off of that. You can see here's the brain,
right,
the spinal cord. Now in utero, the baby's in this fetal curve, and you have the amniotic fluid. So if the mother falls, this curve will allow protection. It works like a big spring. At 3 to 6 months, the baby lifts their head up, and they do the tummy time. That's when they develop the proper cervical curve. So if you don't have a good curve in your neck, either you didn't develop it with the right development, tummy time, or you had some kind of trauma to your neck. So when somebody gets into an accident, we can look at the curve, and if their head's forward with a lost curve, that's a very common finding after an accident. At 6 to 12 months, they develop the forward curve in the low back. So when they're crawling, 6 to 12 months, you develop the forward low back curve. So the same thing, if you don't have that curve, either you didn't develop it at that time, or you had some kind of trauma that caused it to reverse. So that can be from an accident also. Defense against germs, there's no magic bullet instant solution, miracle cure against viruses or bacteria. There's only increased internal resistance from hard work nutrition, exercise, rest, and positive mental attitude. The central nervous system controls the 5 systems of the human body: glandular, elimination system, digestive system, musculoskeletal system, and the circulatory elimination system. So your brain sends signals down to the spinal cord, controls and coordinates all these systems. Gray's Anatomy states the central nervous system controls and coordinates every other cell, tissue, and organ in the human body. So the brain sends these signals out, down the spinal cord. That's what keeps us healthy, from above down, inside out. Your body's 98% new every year. That's good news. You still have to get your hair cut?
Yeah.
Do you have to get your fingernails clipped?
Oh, yeah.
Okay, so your body's pushing out new cells. So the question is, are you regenerating or degenerating? Are the cells, the new ones, healthier than the ones that were there before? So that's what our focus is going to be on. Guidance Physiology states the autonomic nervous system is the major system controlling the mechanisms of homeostasis. You're going to get all these questions, right? So homeostasis is your body's ability to adapt to the environment. So is a fever good or bad?
It would be good.
If you ate a bad oyster and threw up, is that good or bad?
It's good.
So your health is your body's ability to adapt to the environment. How many people take medication covering up those symptoms?
No,
If your stomach's upset after eating an oyster, you wouldn't want to take Pepto-Bismol and keep it in there, right? You want to get rid of it because that stuff shouldn't be in your body. Subluxation is a bone out of place interfering with a nerve. Can you remember that if I give you a quiz in a few minutes?
You're not going to, though, are you?
Yeah, probably.
Oh, no.
And we see the word silent decay there because 90% of the nerves control and coordinate your bodily functions. Only 10% have to do with pain. So you can get out of alignment really bad without ever feeling symptoms. Many times this is going on, the person doesn't feel anything, and then they get into an auto accident, and that additional trauma, all of a sudden they feel all the things that they should have been feeling all along. They just needed that traumatic event to bring it all on. But everything was getting unhealthy before the accident occurred. They just weren't feeling it. Your body is like a garden with proper raw materials and no interference. You will regenerate and be healthy. Healing takes time. So the hose is like the spinal cord, the sprinkler is like the nerves, the flowers are like the organs. If we have a rock on a hose, the roses are going to die. If we take that rock off the hose, then things have a chance to heal and regenerate. Subluxations distort the structure of the spine, reducing and eliminating curves, therefore altering the biomechanics of the spine. Research shows when this happens, you create a degenerative process that always goes to completion. So we should have these normal curves. They make our body strong. If they get altered, like from an accident, then that's going to cause dysfunction in the body. And what this is saying is it will always eventually cause degeneration to occur. They did a famous study called the Windsor autopsies, and they looked at 100 cadavers, and what they found was everybody had some pinched nerves. The worse the pinched nerve, the worse the organ dysfunction. So if you have a pinched nerve, wherever that nerve goes, that organ's not going to function as well. The worse the pinched nerve or the bony degeneration around that nerve, the worse the pathology is going to be in the organ. So what are we going to do about it? We're going to get adjusted, allowing the body to regenerate. Okay, by taking the rock off the hose, your body has a better chance to heal. Why do you go to a chiropractor? To get adjusted, correcting and preventing subluxations. Subluxations are, what is a subluxation?
We just talked about
Yeah, a subluxation is a bone out of alignment, interfering with the nerve, so the brain can't get the signals out.
Right.
Wherever that nerve goes, those organs aren't going to work as well. Only 10% of the situation causes pain. All the rest control your bodily functions.
Does any of that come into play with spinal stenosis?
Yes. So there's two kinds of spinal stenosis. One you're born with, meaning genetically the spinal cord opening or the nerve root opening is smaller than they're supposed to be. And then if you're out of alignment and your spine starts to degenerate, those bony spurs also close the openings. So if you have spinal stenosis, either old or new, and you get into an accident, it's just easier for the nerves to be interfered with. Degenerating spine. This patient came in at age 52 with neck pain, shoulder pain, mid-back pain, low back pain, numbness down and tingling down the left arm, depression, migraines, high blood pressure, anxiety, insomnia, tinnitus, and acid reflux. A lot of people after accidents have all those symptoms. Work has become difficult. They no longer can hike or walk due to pain. Their rate quality of life is 3 out of 10. They're on pain medication and blood pressure medication, and they just received their first chiropractic adjustment. The head is severely forward. They've got a reversal of the curve that stretches the spinal cord and nerves. They have disc degeneration, bone spurs. So no wonder they have all those symptoms. This is a healthy spine, no pain or condition. Patient walks 2 miles pain-free every day, works pain-free, is on no medication. They do take Corella, which is a compressed algae, which has all your vitamins, minerals, and protein in it. Also makes your body more alkaline, which helps to reduce pain. At age 26, they went to corrective chiropractic care, and they've had at least a monthly maintenance adjustment every month since then, and they're 55 years old. So they're 3 years older than the previous patient. Their head's half as far forward. They have the proper curve in the neck, proper disc spacing, no bone spurs, spinal cord is relaxed, no symptoms or condition. So I don't think that's a coincidence. Now, if this person got into an accident, they'd have a lot less symptoms than the other patient because they had a healthy spine going into it.
To begin with, right?
So wherever you are, we want to work toward that healthy spine. This patient came in with severe migraines. She'd been a patient at Mayo. She was in about 6th or 7th grade, chronic migraines. She was on migraine medication. She'd been to a neurologist, and the only hope they had for her was migraine medication. Even with the migraine medication, she was still missing school and had migraines every day. So when we took the x-ray, we noticed her head was very far forward. The occiput was at this angle, C1 was at this angle. That creates a lot of compression here. Those two should be parallel. She had a complete reversal of the curve. That's going to stretch the spinal cord and nerves. After 2 months of corrective care, the skull and the first cervical were parallel, relaxing the brainstem. She had less forward head, restored the curve in the neck, so that relaxed the spinal cord.
That was 2 months?
Yes.
Wow.
So after that, she was off all the medication, no more migraines, and she was back to school full time. So if she had never come in, she would have just been the migraine medication and suffered from the side effects of the migraine medication.
Yep.
This patient had scoliosis discovered when she was 9 years old. The curve under our care improved from 22 degrees to 16 degrees to 10 degrees over a 3-year period of time. Now, the interesting thing about this case is the upper neck that was way out of alignment when she had the 22-degree curve. It got a lot better, went down to 16, and then here it went down to 10 degrees. So what this is showing is the upper neck is very important to control the rest of your body, including causing scoliosis. So in an auto accident, the very most least stable ligaments in your neck are in the very upper neck. So this is a very common thing that happens after a car accident. So it can cause a lot of other things to happen.
Which kind of looks like mine.
Yeah. This is an adult with scoliosis. With our care, she went from 24/12 to 13/9. This is a 12-year-old that got into an accident, and you can see their neck got way out of alignment. On the third visit, we re-x-rayed her, and look at the correction she made. So because she was so young, it was easier to make a quick correction on her. But if this would have been left uncorrected, she would have had a life of ill health because of that misalignment. This patient had a complete loss of the lumbar curve, like this. We're seeing this very commonly in children today because of gaming and phones. We were able to correct this in 12 visits. You can see the restoration of the curve. This kind of lost lumbar curve is also common after auto accidents. This patient's father is a medical doctor up in South Carolina. She came down for corrective care. We were able to reduce her down below scoliosis level, and that occurred over a 6-month period of time. This was a patient from Palm Coast, and you can see they were able to reduce their scoliosis down to no longer having a scoliosis in 9 months. These are some of the things we do for scoliosis patients, but also for accident patients. Why are scoliosis patients and accident patients very similar? The very upper neck is the control center. So you have the occiput, the atlas, and the second cervical. And that's the control center that if it gets pressure on it can cause scoliosis. It's also the most common area injured in an auto accident. So how do we correct this? Well, we restore motion and flexibility with wobble chair exercise, head back over the shoulders and curve over, head back over the shoulders and the curve of the neck with cervical repeat traction. Eckert table helps with disc and ligament injuries. Cervical vibratory traction helps bring the head back over the shoulders and the curve of the neck. Core stem helps with muscles. In auto accidents, very commonly, you have a lot of lactic acid and muscle damage, and this helps to keep that moving. Mechanical drop helps bring the head back over the shoulders, curve of the neck, also corrects rib deformation. The adjustment, another similarity between scoliosis and auto accidents is ligament damage in the neck. So it's very common for scoliosis patients to have ligament damage in the neck, very common for auto injuries to have ligament damage in the neck. So when we adjust the neck, we use a handheld instrument. It provides a very controlled adjustment based on what the x-rays look like, which is different from a manual adjustment, which may increase the ligament instability. This is working on improving it. If a patient's lost the primary fetal curve, which is very common in scoliosis, we'll do this kyphosis restoration. Scoliosis traction chair. Patient is placed in a mirror image of their curve. The chair vibrates at a frequency to bring everything back to normal, to get the brain to hold everything in alignment. We do something similar to this with accident cases called spinal weighting. And so when you're standing on the vibe, so let's say your head's forward like this, and we put a weight here. Initially, your head's going to go forward, but then the brain wants to bring it back into position like this. So if after the accident, your head goes forward like this, this is going to help to restore that position. Every inch your head's forward, it feels like it weighs another 10 pounds. So when you have interfered nerves and damaged muscle and your head's forward, you're going to get a lot of chronic pain and inflammation from the accident. If it heals like that, then you're going to have a lifetime of issues. Scoli brace is the future of scoliosis bracing. It's an overcorrective or supercorrective brace. Normal medical bracing just kind of holds your spine in position, hoping it doesn't get worse. The Scoli brace, if you're in this position, is going to bring you opposite to help make an overcorrection. And how we make it with a 3-dimensional scanner, creates a hologram of your body. Then we send that information to Australia with your posture pictures and x-rays, and they make the Scoli brace. It velcros in the front so you can put it on yourself. There's holes for ventilation because it gets hot in Florida. It moves you in the direction of the correction, but not in the direction that makes it worse. So you actually are exercising your spine inside the brace when you're wearing it, and that prevents atrophy. So one of the things with old medical bracing is it holds your spine in place, but it's just like a tube that's tight. So your body could atrophy, but this one, you can move in the direction of the correction, so your spine is exercising in that better position, so it prevents atrophy. Now, we have all our patients do exercises also, but this is like an added bonus to the way it works. So if the patient is to the right, the brace brings them to the left. 12 months after wearing the brace, you can see they're straight without the brace.
Wow.
This patient went from 33 degrees to 11 degrees to 6 degrees in 22 months. This is an adult wearing the brace. They go from 64 degrees to 39 degrees wearing the brace. So it's not that the scoliosis is corrected, but it improves the position of it, makes them feel better, stabilizes it, prevents it from getting worse.
Less pain.
And less pain, yeah. So in adults, it's about posture and stabilizing things more than correction like in an adolescent, okay? The adult brace is commonly a lower cut like this because they didn't have scoliosis as a child, so there's no scoliosis up here. It develops here when one segment all of a sudden degenerates and it creates a curve. And then there's ligament instability, and so this helps to hold everything in alignment. Waiting is dangerous. Our goal is to avoid surgery. You can get infections. Hardware can break if you get into an accident. There's a saying in the scoliosis research, it's not a question of if the hardware will fail, it's a question of if the patient lives long enough. Meaning if you get hardware at 14 and you live to be 85, odds are something's going to happen in between. Then the question is, what do we do with this hardware that's in there? Do we replace it? Do we take it out? What do we do? How do we get subluxations? Well, there's overwhelming stress, trauma like car accidents, and then there's toxins, okay? So when you get into an accident, all three of these happen, right? You can have a lot of stress. You have the mechanical part of the trauma itself to your spine. If you take medications, the toxicity in the liver and kidney can actually create a type of healing in your soft tissue, which creates long-term pain. So what they found was if you're taking a lot of even non-steroidal anti-inflammatories, even Tylenol, it creates a type of scar tissue that when you remove the source of the pain, the way the scar tissue develops, it's a constant source of pain. It doesn't actually ever go away because the tissues don't heal right. That's why we like using the ice. It's controlling the healing. It's not stopping the inflammation, it's just controlling it. So you feel better and the tissue heals a little bit better. Right. If you completely stop it, then things don't heal right. The original subluxation is birth trauma. Similar to auto accidents, it can damage the upper neck. You can see this is a photo taken from a video teaching doctors how to deliver babies in the Navy. Do you see anything wrong with that photo? They're pulling the head, which can damage the ligaments in the neck, just like a car accident. But these are little babies, very small bones and ligaments. If things don't go good with the birth process, then they'll go to using forceps or even cesarean. The cause of all disease is your body's inability to regenerate. Balance equals health. When you're in balance physically, chemically, and emotionally, you will be healthy. So if you get into an accident and you're out of balance, you'll have a hard time healing. If we keep you in balance, you're going to heal better.
I'm already a believer in that.
Fourth attitude, only go to the doctor when you're sick and you better have insurance. Better to go to the doctor when you're healthy, then you won't need insurance. Fifth attitude, it costs money to be healthy. True, however, it costs a lot more money to be sick. 50% of all bankruptcies are caused by medical bills. Prevention makes more sense. Take care of your incredible body. Worst case scenario is you're out of work and you have accumulating medical bills. So if you're looking for something to motivate you to eat right, exercise, smile, then think about that, right? Because that's the alternative. This is the way to prevent it. Stay in alignment. In the state of Florida, we have a very unusual auto insurance law. It's a no-fault state. So no matter whose fault it is in the accident, all the billing initially goes through your insurance. Right. And most states aren't like that, okay? Also, if you get into an accident, you have 14 days to get to the doctor, and that doctor has got to document that you have an emergency medical condition. If they don't do the paperwork right, it can create a lot of problems for you. So if you get into an accident, make sure you get checked in 14 days. The symptoms can be unusual. And just in the last few weeks, we've had patients come in with almost all these symptoms from auto accidents, right? You can have nausea, dizziness, difficulty concentrating, draw trouble, insomnia, wrist pain, numbness, changes in vision, lightheadedness. All of these things can be related to this upper neck being out of alignment because this bone's the closest bone to the brain. 90% of all the information that comes out of here relates to brain function. It has more impact on the brain than any joint in the body. And when your head gets whipped around in an accident, it'll damage this joint. That's going to interfere with the signals to your brain. So it can cause a lot of different things to happen.
That's the first place I had pain.
Yeah, very common.
And it was instant.
So you must see a doctor within 14 days of your car accident in order for your PIP, your personal insurance protection, car accident insurance to pay for any auto-related health care. Get into an accident, get a checkup, make sure it says emergency medical condition. 3 phases of chiropractic care. The first phase is relief care. If you're not feeling better, you're not going to be happy. You're never going to refer another patient to my office, right? So our first goal is to make sure that you're feeling better. Then you're going to refer a patient to my office, right? Whoa. The second goal is corrective care, meaning we want to stabilize things so that the problem just does not come back or not. This can vary from intensive care, like when patients come from other countries to get their scoliosis worked on, which is twice a day for 2 weeks, or it could be 2 times a week. Everybody's a little bit different, but basically we're working on correcting the spine as close to normal as we can to maximize your health. Then the last phase is prevention. You're not aware whether you're in alignment or not because 90% of the nerves control your bodily functions. They don't cause pain. Only 10% cause pain. So you can have a lot of things go wrong without being aware of it. So that's where prevention comes in. We recommend people get checked once a week to once a month based on their spine and their stress level. Everybody's a little bit different. The neck bone helps to bring the head back over the shoulders and the curve in the neck. So most people are sleeping like this, so it's going to be hard for their body to heal, and they're constantly going to have pressure on their spinal cord. So the neck bone allows your head to be back on the bed, putting the curve in the neck. Now here in this picture, I'm also using prism glasses, so I'm looking this way, but I'm seeing this way. So this helps to keep the head back over the shoulders. You can read in bed, use a device, use your phone without hurting your neck. That's what the neck bone looks like. Yeah. An ounce of prevention is worth a pound of cure, Benjamin Franklin. This little guy had infantile torticollis. So when he was born, he was like this and like this. The doctors were going to come in here and cut this muscle to balance things out. The mother instead chose to bring him in here. And you can see she's happy with the care. You can see he's doing the tummy time. So he's working on developing that curve in the neck as he's getting adjusted. Prevention starts early. This patient has 6 children. They all had been adjusted right after birth. She was a patient with all the pregnancies. So with being in alignment, it's going to be easier for you to deliver the baby. So pregnant delivery times are usually shorter and less painful if you're in alignment. And then even a home birth that's perfect can be traumatic to a baby's neck. So it's important for them to get checked right away. Okay.
How can you check them though if they're pregnant? Because aren't they not supposed to have?
We don't do
X-rays?
X-rays unless it's an unusual situation.
Okay, gotcha.
And we have quite a few midwives, OBGYNs that refer to our office. Because when you're pregnant, you shouldn't be taking medication, correct? Because it'll pass on to the baby. So if OBGYNs will commonly refer people with headaches, back pain, leg pain. Nurse practitioners commonly work for OBGYNs, okay? So they will refer to us. Midwives that deliver babies at home, they have a very common philosophy as chiropractic, meaning your body heals above, down, inside out. It just doesn't need any interference. So the midwife is working on removing interference, anything interfering with the natural delivery. The chiropractor is working on anything that's interfering with the normal nervous system. So midwives and chiropractors work very well together. So we have quite a few that refer us patients. Science-based nutrition is a system of hair, blood, and urine analysis that allows us to see mineral and vitamin deficiency and tells you which vitamins you should take or maybe you don't need to take any. So we go through vitals, health history, what your current diagnosis is, medications. Then based on what we find, we come up with our own diagnosis of what's going on with you. And that's going to be based on hair tests, which can show metal toxicity or mineral deficiency, blood tests, which can show all your bodily functions, but also your vitamin levels. This is a panel that you wouldn't get from your standard GP. It's something that's geared more toward toxicity and vitamin and mineral deficiencies. And then we give you a specific formula to balance what we saw in the hair, blood, and urine. And then a few months later, we would retest to check and see how you're doing. So that is something we have available in the office. Just let us know if you're interested.
Yeah, that's nice.
When you find that we've helped you out, if you let other people know, we'd appreciate it. That's how most people find us. Do you have any questions for us?
My only question is with lordosis, are you able to reverse lordosis the way you can scoliosis?
So you can have hyperlordosis. So from the side of your spine, you should have a forward lordotic curve in the neck.
Right.
A 40-degree curve is normal. Most people's head's forward with a loss of the lordosis. We specialize in improving that as close to normal as we can. And then in the lower back, you should have a forward curve here. Some people have too much of that curve, which is called a hyperlordosis.
Yes.
And that'll jam the nerves and the facets back here. Sometimes the person has a spondylolisthesis where L4, L5 slips forward, and there's a lot of ligament instability. It's actually something that happens at birth or shortly after. So genetically, the patient usually, this bone right here is longer than it's supposed to be. And that will actually, at birth or shortly after, will crack. And then these two segments slip apart from each other. So this will slide forward, this will slide backward. And so there's some very specialized adjustments and exercises for that we get some really good results for. Okay. And that is one of the reasons why we x-ray patients. Because if you're getting adjusted and you didn't know this was present, right, this bone will feel like it slid this way if I just palpate the person. But in actuality, this one's gone forward. So if you adjust them like that, it's not going to be as beneficial as if you did some special adjustments and exercises for what we call a spondylolisthesis. So that many times goes along with hyperlordosis. So with those patients, we're going to flatten the lower back and work on bringing this back this way. Okay?
Okay.
So there is a lot you can do to help hyperlordosis,
Okay.
but that's the side view,
Right.
where scoliosis is the front view.
Front view, right.
So scoliosis is a 10-degree tip
Right.
at the top vertebra of the curve, in the bottom of the curve, in the bottom vertebra of the curve, and then that makes this curve. If it's 10 degrees or more, that's a scoliosis. If it's 40 degrees in an adolescent, surgery is recommended. Usually an adult, 60 degrees, surgery is recommended. Anything else?
No, I think that's it.
All right. Well, thank you for joining us, and we appreciate you guys being with us tonight.